Hi, I'm Jim Torgerson, CEO of the United Illuminating Co and Chairman of the Connecticut Regional Institute for the 21st Century, more commonly referred to as the Institute. The Institute provides continuing opportunities for its members and other organizations to discuss and study important issues regarding Connecticut's competitiveness. For the past 2 years, the Institute has tracked the state's continuing battle to wrestle with the fiscal and economic crisis. The turmoil in the economy we have experienced over the last 18 months has created both increased need for public services while sharply reducing state revenues. The numbers in Connecticut, such as state budget deficits, currently of $10 billion over the next 3 fiscal years, have dramatic implications for the role and cost of government at all levels and are of increasing concern. The Institute is tackling these issues by examining elements of spending that account for a significant percentage of the state's budget and where shifts in approaches to service delivery could make a real difference. We engaged the accounting, tax, and business consulting firm of BlumShapiro to help embark on a series of studies. The Institute's first study on long-term care was released in March 2010. The latest report examines Connecticut's correction, parole, and probation systems. The Institute's approach to this topic was similar to the previous study. Our goal today is to provide political leaders in the executive and legislative branches of government with tools to reinvent Connecticut's approach to state government and the delivery of services, and by assisting in the state's economic growth and vitality. I'm joined today by Brian Renstrom, a partner at BlumShapiro, who will provide us with an overview of findings pertaining to Connecticut's correction, parole, and probation systems.
Thank you, Jim. Let me start by stating some very important context for anyone studying incarceration systems, and certainly what we learned as a part of this program. And that is that many societal issues have direct impact on any incarcerated population. Some of these issues include employment, housing, mental health, education, parenting, and substance abuse. These are all very difficult issues, and our study did not consider them as we analyzed Connecticut's correction, parole, and probation systems. What we did find is that the state's correction, parole, and probation systems are complex. They have many causal and effect relationships between various elements within the overall criminal justice system, such as local and state police, justice policy, and the prosecutorial process. Again, our scope concentrated on correction, parole, and probation within the state of Connecticut. When we looked at this issue from a national perspective, we were not surprised to find that costs in these systems are directly tied to the size of the incarcerated population. America's prison population has been increasing for more than 30 years. But this increase has been driven more by public policy choices, such as mandatory sentencing and broadened definitions of criminal activity. National studies and data suggest that treatment, reentry plans, rehabilitation, and community correction programs are much more productive and cost-effective for many offenders compared to imprisonment. Approximately 70% of all offenders serve all or part of their sentences in the community. Costs of these systems are high and growing fast. According to recent calculations, the average daily expenditure per inmate in Connecticut in 2008 through 2009 was approximately $92.35. This, compared to other states with unified correction systems like Delaware, which was on the low end at $82, and Vermont on the high end at $139 per day. Even with the recent reductions in prison population in Connecticut, the costs of the Department of Correction continue to rise. Approximately 70% of Connecticut's budget, about $54.50 a day, is pay and benefits for Department of Correction employees. Direct staffing accounts for 58% of DOC's total budget. Based on current union contracts, the only effective way to control this cost is to reduce the number of inmates. By doing this, it's possible to close facilities or parts of facilities. Corrections personnel can then be reassigned among facilities, and over time their numbers can be reduced. However, under current union contracts, workforce levels cannot be directly reduced based on reductions in prison population. Connecticut's current prison population is 18,555. This represents a reduction of 959 prisoners since 2008. But total prison population in Connecticut could have been much higher. Projections as early as 2002 suggested that close to 30,000 could be incarcerated today. However, shifts in policy have made the difference, reducing projected prison growth without increasing crime or risking the safety of state of Connecticut residents. Consistent with the Institute's other work looking at the state of Connecticut government, issues within the state's correction, parole, and probation systems, such as cross-agency leadership, coordination, and accountability, inadequate information technology, are pervasive. Steps have been taken to adopt some of the best thinking and national trends to improve our systems, but more must be done. Much of this work and accomplishment has been done under the legislatively created CJPAC organization. This group is ad hoc in nature and has no real authority. We believe that this group, or one like it, needs to be formalized and given authority over these systems. This authority needs to develop a comprehensive strategy that links and defines the role of correction, parole, and probation within the entire criminal justice system in Connecticut. Real measurement systems must also be established that ensure we are getting results from these systems. And finally, the strategy must identify and fund the best community-based programs to support these systems. Community-based programs are shown to be proven cost-effective mechanisms for facilitating education, prisoner reentry, and employment. The importance of these programs cannot be overstated in tackling some of the societal issues that affect our incarcerated population.
Thanks, Brian. In the last 3 years, Connecticut has piloted and moved in directions consistent with best practices nationwide. The issue is whether Connecticut, particularly with the recent leadership change in the executive branch, will continue the momentum that has begun. As Brian pointed out earlier, many reforms have already been instituted. Connecticut's initiatives to improve must be supported. The new administration should not look to the correction, parole, and probation systems for major changes or cost savings, but should continue and systematically institutionalize the change that has begun. Establishing, maintaining, and expanding effective early childhood education, literacy, community development, public health, and housing programs all contribute to the creation of a social and cultural environment where individuals do not turn to crime as their primary means of survival. Our next study examines Connecticut's state employee retirement benefits program, how it compares to other states, and future funding issues for the program. I invite you to be a partner with the Institute as we choose other areas of state government that could benefit from this type of objective review. We hope you'll give serious thought to our findings as well as our proposed solutions to the problems currently facing Connecticut's fiscal future. Thank you for providing us with the opportunity to present you with these findings. For further information and a full list of the Institute's primary recommendations regarding this study, please visit ctregionalinstitute.org.